Good evening. I'd like to welcome you to the August meeting of the Pitt County Board of Health. We'd like to welcome our TV audience as well on Suddenlink. We'll start off. Are there any public comments tonight? Okay, hearing none, we'll move on. The minutes of the July 14th meeting were distributed in advance. And are there any corrections or additions to those minutes from the board members? Okay, hearing none, is there a motion to approve the minutes as distributed? Lowell Spate?
Yes.
All right, motion's been made by Lowell. Is there a second? Looks like Kelly Pack Smith. All right, so Betsy will do a roll call on the yeas and nays.
Tom Colson,
Here.
Tina Dixon,
Here.
Martha Engelkey, Rex Fleming, Adam Harrell, Mark Hayes,
Here.
Scott McIntosh,
Here.
Natish Patidar, Kelly Pack Smith,
Present.
Lowell Spate,
Aye.
okay, and I apologize, that was, everyone was saying present, so that was for our roll call. I do need to take a vote for the minutes to be approved next. So the next list will be for the approval of the minutes.
Okay, sorry.
I apologize.
No, I didn't call it right. So
Tom Colson,
this is a yay or nay, right?
this is a yay or nay,
approve.
not a here.
Yay.
Okay, Tina Dixon,
Yay.
Mark Hayes,
Yay.
Scott McIntosh,
Yay.
and then that'll be all. Thank you.
Okay, all right. So thank you very much. The minutes are approved. Move on to the fiscal report. I think Marcia Hall, there she is.
Hey everybody, let's see what they got for me. Well, here we go. Betsy, can y'all see that okay?
It's not on our screen.
Okay.
Now it is.
All right, everybody. This is our first period of fiscal year 21, and we started our new fiscal year July 1st. So the month of July, we have our original budget was $12,353,612. And when we submitted the budget back in March, April, a lot of things can happen between March and April until July 1. We were informed our health check coordinator position that was funded through Medicaid reform through Access East was not renewed. They were able to, consolidate that position with some of their care case managers. So we had a decrease of $46,860. And so our current overall budget is $12,320,291. We did have some revenue that came in. I just want to remind you that with the Medicaid, the year before, we had decreased it by 20% across all of our clinical programs because of Medicaid reform. that seems like a long memory with COVID right now, but we did have a shortfall of July of $7,000, which is probably to be expected with all of our COVID testing. And if you take the time and items involved, we do have a adjusted deficit of $37,518, but July was a 3 payroll month. So this all hopefully will shake out next month in period 2. And I also wanted to mention we added the WIC special funding. They received $13,000, which was added to our budget, and they are doing some really neat things in the lobby of the health department. So when you get back over that way, you might want to check it out. We're all very excited about what's going on in the lobby.
Very good. Does anybody have any questions for Marcia? Yeah, those three payroll months really hit the balance sheet, don't they?
They do.
That's okay. Hearing no questions, is there a motion to approve the budget as presented? So Scott
Scott McIntosh was
Scott's
first.
first, yeah. Yeah.
And then Kelly Pack-Smith was second.
Kelly second. Okay, all right, very good. Any further discussion? All right, Betsy will do a roll call vote for yea and nay on approval of the budget.
Tom Colson,
Yay.
Tina Dixon,
Yay.
Mark Hayes, Mark Hayes, Lowell Spate,
I wonder if there's a lag or something. Can y'all hear us okay? Betsy's calling out your names, but we're not hearing any responses.
Yeah, Tina said yes.
They may be unable to unmute themselves, which is the problem I was having last meeting.
Oh, that's what, yeah, last time, okay.
Okay.
All right.
okay.
All right, I'll try again.
Okay, so let's try this again. Mark Hayes? Can you give us a thumbs up on the screen or a thumbs down? Okay, we got it. And how about Lowell Spate? Can we get a thumbs up or a thumbs down? If we could see you. There you go, gotcha. Okay, we've got that one. That's it.
We got enough?
Yeah, that's
Okay.
it. That was everyone. Thank
Okay,
you.
Thank you. Appreciate it. Marcia, do you have anything else for us?
I got a few little things for you guys. I just wanted to mention last month I did not have this, but I do have it this month. We have the grants fall outside of the approved budget. The county commissioners do approve it, and it does get added to Munis, but it does not fall into the overall report. So I wanted to show that we have $639,000 in grants, and I just wanted to show you the balance at the end of July. They do support several positions. 7 1/4 positions are out in grants. Some of this is state funds, some of it is our partner Vidant, some of it is the FDA. The grants rolled over because they sometimes are not on the same fiscal year as our county funding, but I did not have that for you, but that was included in the email that I sent earlier. Just wanted to mention a few things. Also, you may have received the vacant positions. There's some movement on that. We do have 23. We did have a resignation. One of our breastfeeding counselors are going back to school full-time for her master's, but we have been so busy with testing sites. It's been really hard to schedule any interviews, but you can see the status as of yesterday. Some of them are ready to interview, some of them are being advertised. But if you have any questions about anything, please email me, or you can ask me now. But I just wanted to give you a status on that. Martin and Starnes auditors, they are the county auditors. They are on site this week. They are auditing our maternal and child health federal block grant programs, which is a total of $1.3 million. And that block of money supports our maternal health program, our family planning program, our Triple P programs, Healthy Beginnings, and Nurse Family Partnership. So I applaud all the coordinators of these programs getting the documents to them. Dentrix, which we've been working on with MIS, I've got to give a very big cheer for Chandler Buck in the MIS department and Donna Davis. They've been helping us. Dentrix will be on site tomorrow and Wednesday and Thursday to help with the software. If you remember, the HIS system from the state was breaking. We've got to get new software, and Dentrix is the leading institutional dental software. All of our admin, business office, HR, registration have been helping with testing sites. I cannot thank them enough. Kim Prayer, our business office manager, has been purchasing items, Gatorades, waters over the weekends. Our registration interpreters are volunteering at all the test sites. They are scanning in all the consents into Epic. Kelly Joyner is reading every piece of material from NC Tracks with fees and Medicaid and telehealth. 3 admin employees were part of the 15 that were part of the testing last week, including myself. So we is all hands on deck at Pitt County Health Department. And we are all tired and stressed, and we're worried about how our kids are going to look next week. But I just want to tell you that I cannot be more proud of our employees of getting it done the past few weeks. I'm sure Amy's going to talk a little bit about the testing sites and Dr. Hardy, but our employees have really stepped up. Betsy has handled all of our outside contractors for the testing, the nursing testing, but impressive staff. So.
Absolutely. Yeah, well, I'm sure we'll hear more about it as well, so,
Yes.
very good.
The only other thing, what, do I need to finish that for go into the fees, or can I move on into the fees?
Let's see, we don't have any items of old business, so we move on into new business, and that'll put you up first then.
Okay, awesome. In the email today, the state has allowed for Medicaid to increase fees that we have on the books for services at the health department. And as you can see, they are really promoting telehealth fees, and our current rate and the Medicaid reimbursement rate and our proposed rates are laid out. These reimbursed rates are at this moment valid through September 30th through the state. I do feel like they are going to extend that date. But we need the Board of Health to approve our proposed fees so that we can get this into Epic. And so these are various already clinic service fees that we are already established. They're approved, but with the pandemic, the rates are increased by 40%. But it would be a very nice additional revenue if we could get these on the books.
Now, just to clarify, these rates pretty much have, tripled or?
Some of them, yes.
Tripled or quadrupled?
Yes, and we listed it by CPT codes because there are various stages of office visits depending on age and program, and they're really detailed. But our current fee, out of all the fees, these are the ones that we are losing money on at this pandemic rate that we need to address.
And just to clarify for the public, while these rates, assuming we approve them, will go up and will be reimbursed better, this has no impact on the co-pays by the patients, right?
Correct.
And their families, so.
This is only on our reimbursement rate. We are still seeing anybody that walks in the door that needs services.
Right, so just to reassure everyone out there listening on the on TV channel, this will not increase what you pay. It's only increases what Medicaid pays to the health department.
Correct.
So don't be concerned.
That's
about
it.
that, so.
We want to take care of all the babies of Pitt County.
Do any of the board members have any questions for Marcia?
Mark Hayes.
Yes, sir.
No questions, just motion to approve.
Motion approved, okay. Is there a second?
Kelly Packsmith.
Kelly, okay. Any further discussion?
That wasn't a second.
That was a question for Kelly.
Oh, question,
It
oh,
was.
okay.
It was. But I can wait till the discussion, Dr. Ramsey. I can go ahead and second it and then wait for the discussion.
Okay. All right. All right, yeah, go ahead with your question, sure.
Yes, sir. Thank you. So I heard you say that this does not increase what the public will pay. Marcia, can you just explain again for me the difference between the proposed fee column and the column where it already says Medicaid reimbursement 40%?
Correct. So what happens here is you really want your fee to be more than the Medicaid reimbursement rate. So last year, I'm just going to give you an example. Our dental program, it was kind of offline for a while, and our rates had not been reviewed. And the state said, hey, we're going to go back through January 1, and anything that you have filed, any claims you have filed, we're going to give you a 10% bump, just because. Well, we missed out on that bump, and we missed out on the difference between your fee and the Medicaid rate. So Medicaid knows, it kind of ties in back to our Medicaid cost study. Medicaid knows that they're not paying us enough on the front end to do the services that it actually cost us. So this way, they are actually giving us money on the front end, where they usually give it to us on the Medicaid cost study and on the back end. So you always want your fee to be more than what their Medicaid reimbursement rate, in case they say, hey, pandemic, hurricane, any type of situation, that they give you a % increase.
So is Medicaid paying $97 or $91.29?
They're paying $91.29.
But we're charging $97.
Correct.
Okay. But the patient still is not paying the difference between those two.
Correct.
Okay.
I think that's a great question, and it's very important that people understand that.
This does not affect anybody, their copay, anything. This affects our reimbursement rate when we file those charges in NC tracks for the office visits.
So essentially, you'll be denied for the difference unless they give you an additional bump for some reason.
Correct. So right now,
Got it.
if you came in for an office visit, we're going to charge $75.90, and we're missing out on the difference between $91.29 and $75.90.
Got it.
This has been a big plus for telehealth all across the country as a result of this. So.
Correct. And from what I can tell, and Dr. Hardy may elaborate more on it, our providers like the telehealth, and I think our postpartum nurses, the new moms, enjoy the telehealth connection too. So I really think it's an avenue of revenue that we can explore, even hopefully after we get out of the pandemic.
Very good, very good. All right, is there any additional questions or discussion? Okay, Dr. Hayes made the motion, and Kelly Packsmith has seconded, so we'll do a roll call vote, yea or nay. Betsy?
Tom Colson.
Yes.
Tina Dixon.
Yay.
Scott McIntosh. Could we get a thumbs up on the screen? We can't hear you. Got
There
it.
you go, yeah,
And Lowell Spate. All right, thumbs up on the screen. We got it.
all right.
Motion
Very good,
passed.
thank you all very much. Can we do anything about the sound? Because we're going to probably need to have more sound later in the meeting.
We'll talk to the Public Information Office on that.
Okay. All right, let's see. Thank you, Marcia. Anything else?
That's it.
You sure now?
I know, I had a lot for you.
Okay. All right, we'll call up Dr. Kimberly Hardy, Personal Health Division Director, is going to talk about the COVID community testing program. So welcome.
Good evening. Good evening.
Dr. Hardy, thank you. Oh, Rach is on.
Thank you. All right. So here we are. It feels like COVID-19 testing started, I don't know, 3 years ago. But I want to give you an overview of our status of the Pitt County COVID-19 Community Testing Project as it stands today. We do have, until Friday for phase 1 to complete, but we have some interesting information for you. So I'm going to share this with you as if you don't know anything about it, just for the benefit of the public. The purpose of having the COVID-19 community testing project here in Pitt County was to provide access for diagnostic testing to improve surveillance of COVID-19 infection. As you all know, Governor Cooper declared a COVID-19 pandemic a public health emergency back in March. Our target population that we were aiming to provide access for was generally everyone. Certainly we had a focus on people who, of any age, who have an increased risk of severe illness, people who are older adults, older than 65, people with serious underlying medical conditions, including having a BMI greater than 40, those who have cancer, sickle cell disease, severe heart disease, several different medical conditions. Those who are underserved, uninsured, and minorities, whether Latino or African American, we were trying to increase access to these services for the population. The funding for the project, again, you all know this very well. The Pitt County Commissioners allocated $1.2 million of the Federal CARES Act to fund the testing project. There was no billing to patients, and there was no billing for third-party payers, so there was no billing to insurance providers. Initially, when we started the planning for this, our goal was to test 4,290 people. Which was about 165 tests a day, starting July 9th through August 14th, 2020. Our testing site schedule, it did change over time. Initially, we started with a schedule for 8:30 to 12, and then resuming from 1 to 4. But quickly, we learned that it's hot outside. And that was not conducive to the health of our employees, so we changed our testing times. You'll see here this chart does say 8:30 to 12, but it's actually 8:30 to 12:30. So we tested every day at Rhodes High School from 8:30 to 12:30. And then we rotated. We had a mobile team that rotated from Farmville, Bethel, G.R. Whitfield, Ada Middle, and Winterville Volunteer Fire Station from 8:30 to 12:30 every day of the week. Moywood Community Center, we scheduled that testing from 10 to 2. That worked best for that community center. That site had an after-school or a summer program, and parents were asked to drop their children off no later than 9 a.m. So us coming at 10 avoided problems with traffic congestion in that community. And then once a week on Tuesday evenings, we offered the testing at the Pitt County Health Department from 3 to 6. So I've seriously simplified the process for the COVID-19 testing project. There are so many steps that are behind these 3 major steps. The testing on site required that we have a team of people within the health department who prepared supplies and equipment and replenished them daily and had them packed and ready to go the next morning. It required a team of people to surveillance or inventory and make sure that we had enough supplies and to reorder as needed. We needed a team of people, and we learned this quickly. We had such a wonderful response. We did not realize that our laboratory process would require more staff in that area. So we had to increase the staffing in that arena as well so that we could order the testing in Epic and get that taken care of, and to transport the specimens to Vidant and receive the testing kits every week. We have a team of people who are notifying patients of their COVID-19 test results. Our negative test results were communicated through the COVID hotline staff. That's essentially the health education division, and I mean, that room was like, it was like music that you could hear in that room when people were in there working. It was just a constant buzz with them calling patients. Then there's another population of employees who were actually calling patients with positive test results, and those were usually our nurses, whether they were contract nurses or our agency nurses. And then, as I'll talk about a little bit later on, the case investigation and contact tracing aspect of this project is absolutely astronomical. We knew that that was an important part of this process, and I can't actually see my notes from the view on the slide. I did have some data regarding how many patients we actually end up having to contact who were contacts to our index cases. I'll try to pull that in a little bit later. What I'd like to do now is just kind of give you a visual and allow you to be able to see more about what I just said about the process within our agency and what our staff had to do. This was the first day. Oops, let me make that bigger. This was the first day of our orientation, and as we go on, it's actually days after testing where staff was getting things together, staff were getting things together, to prepare for the testing sites. All hands were on deck. Marcia mentioned that everybody was working together. Everybody was working together. We had partners from Pitt County EMS, our Vidant Medical Center partners from the school health program, 16 contract nurses, whether they were from the school health program or just employed with Vidant, joined in to help us make this project a success. We had staff from environmental health, all over, really. When you look at the public health system and you realize that public health, although local public health may be at the center of the system, it takes the entire community working together to make an event like this successful. We had the school system partnering with us to make sure we had the testing sites identified. We had community centers partnering with us, allowing us to use their facilities. While we have never been here before with the COVID-19 testing event and with such a large-scale project, I'd have to say that it is probably one of the proudest moments in my career to see this entire workforce hunker down, sacrifice, work, and even put themselves and their families in harm's way to make sure that our community had COVID-19 testing available to them. It's a very, very proud moment for the public health system. As you see the slides here, this is actually at the Winterville Volunteer Fire Station. It was early in the morning when we were setting up the testing site. We tried to avoid capturing pictures of the people as they were coming to get the testing. Tammy Reese is here in the picture there. She's our laboratory manager, and she touched all of the 4,768 specimens that we've actually tested to date. her and her staff have done a phenomenal job. The pictures that you see here are of Lee Cutler there, who is our CD supervisor. She is actually orienting a portion of the staff as they were organized into roles, whether they were support staff or testers or registration staff. These are our health education team members who were manning the hotlines. As I mentioned before, it was musical hearing them all on the phone. And this is one of our newest employees, Michelle Massenberg, preparing the COVID-19 testing supplies. Our clinic nurses also pitched in and helped. If there was downtime, they were actually entering labs orders into the Epic system. It really took a village to make this come to pass. That's Toria Wilson there, who is in charge of our contact tracing efforts. And again, this is Lee Cutler, our CD nurse supervisor. And this is Christina Forget, our CD nurse. And these next two pictures are of our contract nurses with Vidant School Health. Everyone pitched in and are doing their best to make sure that we get this accomplished. This was late one Tuesday afternoon in the heat. Everybody's trying to get a drink and just catch a breath. And this is Jay Morris, who was phenomenal with helping make sure that we had all of our testing supplies and equipment at our sites when we needed them there. Randy Gentry, that whole team did a phenomenal job with helping us make sure we had everything we needed. So I talked a little bit ahead of my slides, but I am a nerd, and the theoretical aspect of public health is very important to me. And this is what I was talking about in terms of the entire public health system working together actually works for the health of our population. We can protect, promote, and assure the health of our community with all of us working together. I mentioned our partners, but I did not include the Pitt County Sheriff's Department. They were on site at every site every day, at all 3 or 4 sites daily, making sure that the traffic was flowing in the proper manner and that order was kept. Vidant Medical Center processes our labs, but we also used LabCorp initially as we were getting that new ordering system in place. And we had staff support from the NEAS staffing agency as well. Now, how did we do? Well, as of today, I think we did pretty good. As I mentioned, phase 1 of this project will end on Friday. As of today, we have tested 4,768 people for COVID-19, and that's across 8 sites across our county. And that number exceeds our goal that we initially set at 4,290 people tested. So we've exceeded to date our testing numbers by 11%. Now, I want to caution you about this slide. I needed to give you some information about outcomes, but I have to qualify this. The data that you see here is data that was available to me as of last week. These numbers are not hard. They're not the final numbers. You will get another additional report of what our actual positivity rate was. But as of last week, we had 3,030 negative tests, and we had 194 positive tests. That had us at about a 6% positivity rate. And as you all may know, as of today, North Carolina has about a 5% positivity rate of all the tests that have been performed. In case you're wondering, I know people have asked and had questions about how soon will I get my test results? Well, Dr. Silvernail reported that certainly Vidant could report or process those results within 24 hours, and that is certainly true. They have been true to that. It takes a little time internally for that processing. The majority of our patients were notified within 72 hours, either by telephone call or by the Vidant MyChart portal. We did have the first week, we did have a few patients that had their test results reported at 8 days. This was due to we used another laboratory, and there was a bit of a backlog with that laboratory processing. So in the beginning of our process, there were a few patients who did get their tests at 8 days, but that was not our normal. I just want to share some graphs with you that may help you kind of get a visual of the testing project as the weeks went on. Initially, the first week, we had just a phenomenal response of 1,647 people tested. As the weeks went on, that began to level off some, actually reduce in numbers. That first week, though, I do want to point out we had more hours of testing as we were testing from 8 to 12 and 1 to 4. So some of what we see here is actually availability of hours of testing. The second and third week are just not that big of a difference between those two, but I do want to point out last week's numbers with the big yellow arrow here. That is an outlier week. As you all know, we had the threat of the hurricane coming through, and we did halt testing Monday through Wednesday of last week. The fifth week here is just numbers for these first 2 days of the week, so these are certainly, it's not a full week number reporting there, but just to give you an idea as to what the testing, the trend looks, how it looks there. This is another view. This one may not be as friendly, but it allows you to be able to see the testing response by site. This view may be a little deceiving, so I have another one to share with you, but it has the weeks in color code as well. Clearly, you can see that J.H. Rose High School it looks like it was extremely more well attended than the other sites. But on the next slide, I believe the next slide, oh, not that slide. Let me go to the next slide. The next slide kind of normalizes everything. This is an average number of people tested at each site per day. So while J.H. Rose High School may have 16 days of testing, and Bethel only had maybe 4, when I applied the average here, you can see that it actually, Rose High's attendance is not quite as high as it looked. It was not quite as inflated as it looked in the first slide that I showed you. So the top 3 sites would be J.H. Rose High School, Winterville Community Fire Station, and Ada Middle School. So what have we learned? One, this a little humor, it's hot outside. And then we had to make changes in the scheduling. When we first planned this, we were not in July. We were actually in June when we did this, the first round of this planning. We did not realize that the temperatures would spike as they did, and we needed to do things a little different. Lesson learned. The other thing is that it's hurricane season. And that took out some of the days that we had originally planned for testing. Oh, and that actually presents a whole nother discussion about opening shelters in the midst of a pandemic that we are experiencing with COVID-19. As we go forward, we need to consider that East Carolina University and the Pitt County Public School System is returning. ECU returned, actually classes started yesterday with ECU, and the Pitt County School System's classes start next Monday. I'm bringing this up because of the case investigation and contact tracing work that trails behind the work. So it looks like we've done a fantastic job with getting this testing done and testing 4,768 people. But if we have a positivity rate of about 5%, we're going to have roughly, if I'm recalling my notes correctly, we had roughly about 300 people that we would be, actually I used a different figure, I used 5,000. At a 7% positivity rate, it would be 350 people that we would need to contact to tell them they're positive. But if each one of those people had 5 people they had contact with, that is exponential. And it's really beyond what our workforce can actually do. So when we're looking at the funding for the COVID-19 project, we need to consider the back end of the work. the testing is one aspect, but following up and actually limiting the exposures that the positive patients have for the population and community is significant. And then the final consideration is staffing. Our staff had issues as the project rolled on. As you all know, we had a positive COVID-19 case amongst our staff, and that does modify how efficiently we can work and perform the work. Next steps, well, we're ready to roll with phase 2. Next week, we will start doing testing at the health department. We are scaling back a great deal next week to give us an opportunity to breathe, regroup, and prepare for the next phase. So next Tuesday, we will have testing at the health department from 3 to 6. That would be the only testing day for next week. And then the following week, we will begin doing testing Monday, Wednesday, and Thursday from 9 to 12. And we will have testing on Tuesday afternoons from 3 to 6. The other part of our work that we will continue is we will continue case investigation and contact tracing. As I mentioned before, this part of the project is critical to reducing the spread of the COVID-19 infection. This is where my data is. I thought it was in my notes, but theoretically, what it would take for us to contact, or the volume of patients we would have to contact if they were positive, and then their contacts. And that is it. I thought I'd just end with a few pictures just to nail home really that it takes all of us to make this project work, not just our Pitt County Health Department workforce, but the public health systems workforce.
Very good. Thank you very much. It's great to see all the excellent work. We appreciate the support of the county commissioners in getting the funding and helping Dr. Silvernail and your team decide where to actually have the test sites. I see Dr. Hayes and Commissioner Colson have questions or comments.
Dr. Hardy, I had a question about those positive tests.
Yes.
Were these people symptomatic or, I mean, when they were tested, were they being tested just as a screening test? And of the testing that we're doing, how accurate is that testing as far as sensitivity, specificity, or do we know?
Okay. Let me answer the first question first, and then Dr. Ramsey, you may be able to help me with the last one. I know the specificity and sensitivity is extremely high, in the 90s, but I don't know the exact percentage for that. So when we started this project, we did not really interview patients. It was not required. To keep the flow going, we simply tested our patients. August 1st, Dr. Elizabeth Tilson she actually wrote an executive order on July 7th requiring us to capture information. We'd already done our printing for the kickoff on the 9th, so we did not try to go back and reprint and recollate all our paperwork, but we did implement the questions that were required on August 1st. So beginning August 1st, we know if our patients are symptomatic, we know if they live in congregate living settings, we know if they're pregnant, we know if they've ever had COVID-19 testing before. There's a number of questions that our patients have to answer that they started answering on August 1st. So I can't tell you with hard data if they were sick, but the majority of people were coming through the testing site just to test. They want the opportunity to test.
And I'll go ahead and comment about the other part. I would imagine most of these folks were asymptomatic, just in general, but there were probably some that had some symptoms. And I think the county commissioners wanted people tested regardless of symptoms, is what my understanding is from Dr. Silvernail.
Right.
So that being the case, the test is like a Polaroid. That day you do the test, do the swab, it's either positive or negative. If it's positive, it doesn't tell you whether the patient has symptoms or not. after being infected for about 6 days, unless you're immunosuppressed by cancer, chemotherapy, or you've had a transplant and have any rejection drugs on board, you will develop antibodies. These are naturally made proteins, part of the immune response to the virus. And at that point, these antibodies, which are what we call neutralizing antibodies, will then begin to bind to the virus, and after that point, the person is not infectious for others around them anymore. And CDC recently on July 17th came out with revised recommendations about how we deal with that in hospitals, how long we keep people in isolation. And so, again, most of these folks, I think Dr. Hayes' question, most of them are almost certainly asymptomatic, but until they develop antibodies, they can infect other people around them. And so it'd be interesting to see what additional data you get from the additional questions that you ask.
And he asks about the specificity and sensitivity, and I don't have that data with me.
Yeah, they're both up in the 95, 96 percentiles. Yeah. They can be falsely positive in a sense that after day 6, even though a person is improving, and say if you do an antibody test and it's positive, then that detected virus is actually dead. It's called non-replicative virus and will not infect other folks. But when you're doing a single day test like this, you don't know where the patient is along that way. We've talked about, could you do the antibody test, but that's a blood test and it's more time consuming. It's less expensive, but it would add a whole new dimension to the process. And results from those tests are being done elsewhere. Commissioner Colson, I see you have a question or comment.
Well, I guess it's been kind of answered in a way, but if we got a 6% positivity rate and the other 94%, I was just curious, and I think it's been answered, they just came in because they were scared? Or were they symptomatic of regular flu or some other illness, and did they come in for that?
So, being at the testing site, I do know that some people...
Do we have any idea about that?
Some people's employers brought them to testing. So you have a variety of scenarios as to why people got tested. Some came independently. Some were required by their employers to come for testing. They actually bought vans and trucks of their employees in for testing. Some people had symptoms, but that was not the majority of the case. Most people had not had a test. They wanted an opportunity to test. We offered it at no charge to them. They took advantage of the resource. I'm not sure if we'll have that information.
Okay, so of all those people, of the people that are getting the test, do you have any record of how many people have been tested multiple times? And do you count in that 4,700 a person maybe 2 or 3 or however many times if they've had multiple tests?
That's a great question.
Or do you know?
So I have extracted a report from Epic, but today that data is not, I do not have access to all that data. We can report that to you and we can tell you the number of people that were repeats, but I did not sort that and do not have a complete accounting of all the tests that we've done so far. That 3,000 plus the 194 was actually the total count that I had at the time that I had that report available. If you would like to have that, though, we can get that. We can sort that.
So I bushwhacked you, and I didn't. Yeah, well, I think the community would like to know that. I bushwhacked you. I didn't give you any heads up as to what I was going to ask here. But, one of the things that I'm wondering as county commissioner and the cost of this, and I know we got the CARES money and stuff, but with 185,000 people in the county at $60 a whack, if everybody came out and got tested, we'd be talking about $9 million or maybe more. Mm-hmm. So the question, I guess, is, do we need to be just testing people at random? or should they not be feeling like they're sick to really try to get a better handle and be, I'm going to say, more efficient about the use of the test? Or is it or what we're doing now, is that really the best approach? I'm a layman, I don't know.
I think that there is a place for the testing. We will not know the burden of the disease in our community unless we increase the number of people who are tested. Knowing who is positive helps us to help control and contain as best we can the infection. So there is merit for doing the testing. It is a costly test. With the numbers that I reported today, we spent about $286,000 to date on just the test alone. That doesn't include manpower or supplies. That's just Vidant's, what we owe Vidant for the testing. You bring up a good point. I think that people should get tested, but I think that they also should take seriously the recommendations that are coming from our state epidemiologists, our local epidemiologists at Vidant, the 3 W's, wearing a mask when you're in public and closer than 6 feet apart, waiting 6 feet apart from someone, and hand hygiene and cough hygiene. Those things are extremely important. So I don't believe it's an either or. I think it's a 1 and 2. Get tested, practice prevention.
Well, if I could say something else about that, and I'm sure everybody sees this all the time, but we tell people to wear a mask. But how many times you see a person wearing a mask around their chin? How many times you see them where it's just over their mouth? I don't really see the benefits of saying wear a mask unless we follow it with a wear a mask properly. I've brought this up with county commissioners a number of times because it just bothers me. We want to make everybody wear a mask, but then what good is it if they're going to have their nose uncovered? What good is it if it's around their chin?
We agree with you, Commissioner.
Now, that's a rhetorical question. I'm not going to try to pin you down with a question.
Let me answer.
Okay, and I'll finish. Thank you.
Let me try to answer one of your
You've
questions.
done a nice
earlier.
job of answering.
You asked Dr. Hardy about whether there were any repeat positives among the groups. The state, I talked to Zach Moore about this some time back because we're aware of people getting multiple tests in different hospital settings and so forth. They've sorted out so that the multiple tests, so they're basically, it's one, like one person, one vote, one person, one positive test. So that's done at the state, but Dr. Hardy was, referring to what she was going to have to do here to try to answer that question for you. Mm-hmm. And we can certainly talk about this offline, but if you really want to find out what percentage of population has been infected, you do the blood test, accepting the fact that it's not quite as accurate. It's a couple of percentage points less sensitive and less specific, but that would involve, again, it's more invasive in the sense you have to draw blood on folks and a little more difficult for your staff. But depends on the goal of what your testing is. But like I said, I'd be glad to talk to you more of that offline. Dr. Hayes, do you have a question? I thought you had your hand up there a minute ago.
Well, I was just going to comment that I think that and Dr. Hardy can comment, but I think what this probably shows is that it is out there, it is amongst us, it's present, even though I think a large number of people aren't convinced that it is present, but it's out there. And so the question becomes, if it's out there in a bunch of people that are asymptomatic when they come for testing, then it should increase everyone's concern about how they are behaving when they're out in public around people that are seemingly healthy. But the truth is that 5% of those people might actually be positive. They're not showing symptoms yet, but but they're potentially able to transmit the virus to other people. And so if this is a study that's done to essentially give us an idea of where we are as a community, then it has value. I don't know that this necessarily helps us. Well, it does help us contain it to a degree, but hopefully it raises awareness.
Mm-hmm. That's a good point.
Very good. Any other questions for Dr. Hardy? Well, thank you very much for a very detailed and fascinating report. Keep up the good work. See, our next item will be the Health Director's report, and Amy Haddam is substituting for Dr. Silvernail, who's on medical leave. He'll be, I think, back in the office on Friday.
Well,
Welcome,
good evening,
Amy.
everybody. Dr. Silvernail wanted to send his regrets for not being here, but of course he did have surgery yesterday, and I've heard from him yesterday and today, and he's doing well, and actually just received a text from him a little while ago, so I'm pretty sure he's continuing to work from home, but he is doing well. Wanted to commend the personal health team under Dr. Hardy's leadership for the testing program. Dr. Silvernail had in his notes here that through the first 3 weeks of testing, there were over 4,000 individuals tested, as was outlined in Dr. Hardy's report. That's very impressive. Very proud of our personal health team and of all of our staff who pulled together across all divisions to make that happen and are still making it happen. Dr. Silvernail also wanted to send a special thank you to Dr. Ethan Linker, our Pitt County School Superintendent, for allowing us to use several Pitt County schools for testing and providing other support to the testing program. I do want to make a note here that Dr. Linker did ask us to suspend testing at J.H. Rose on Thursday and Friday of this week due to open house. So Dr. Hardy's made arrangements for those tests to be done at the health department, and a news release will be going out about that tomorrow with the new schedule, as well as introducing the phase 2 of testing. So more information to come about that soon. Also, on Thursday, August the 6th, we were notified that one of our staff members had tested positive for COVID-19. Appropriate actions were taken internally. Our external partners were notified as well. And a press release was also sent out notifying the public. And we did hold an in-person media session at 11 o'clock this past Friday, which Dr. Silvernail was available to answer questions from reporters. I also wanted to give you a quick update for the COVID-19 data for North Carolina and Pitt County as of today. North Carolina, there were 137,895 confirmed cases in North Carolina. It was presumed or estimated that 116,969 of those have recovered, and there have been 2,204 deaths within North Carolina. Within Pitt County, as of today, we had 2,054 confirmed cases with an estimated 1,548 recovered, and we have 11 deaths within our county. So moving on to division reports, and following also up with Personal Health Division, again commending that team and Dr. Hardy's leadership, but also wanted to remind everyone that we generally have our communicable disease report during the month of August to the board. And need I say more, with all that's been going on at our agency, there's just not been time for that. However, that has been postponed to the September meeting, so that report will be next month. For Health Education Division, which is the division that falls under my direction, I do want to give a big shout out to the Health Ed team. They have been manning the hotlines actually since March. The numbers have been increasing with the number of calls that we're receiving. They're getting at least 50 to 60 calls per day from the community asking various questions. And as a reminder to the community, that number is 252-902-2300. That would take you to our hotlines. Anybody can call in the community and ask questions related to COVID. We're also responding to email through our COVID email, our dedicated email address. We're getting several questions through the email address each day as well. Hotline staff have also, as Dr. Hardy had mentioned, they've been responding and calling all of the negative test results, and they have called nearly 4,000 individuals who were tested to let them know of their results. I don't have the exact number, but it's close to 4,000 that they have called as of today. I know Dr. Hardy had numbers through last week. This will be adding additional numbers this week. So pretty impressive for the hotline to have called that many people, and we're very appreciative for them for doing that. Also, under the Health Ed Division, we are down 2 staff members. One is a Public Health Educator 1 that was previously an office assistant that we asked the State Office of Personnel to reclassify that to a Public Health Educator 1, and that was approved. We are getting ready to do interviews for that. And our Emergency Preparedness Coordinator resigned on April 30th and went to ECU to serve as an emergency manager there. So we have been without a coordinator, but we are getting ready to do those interviews as well. So those 2 will make the health education team fully staffed again once that's filled, and hopefully that will be filled by September. Other division reports, WIC Nutrition. The COVID-19 related flexibilities remain in place, and those flexibilities would be that individuals do not have to have a physical presence to apply for WIC. There are phone certifications that have been allowed throughout the COVID months, and we also have several breastfeeding flexibilities too, where breast pumps are being delivered in the parking lot if people come to our facility. They can be dropped off at a person's home, of course not going in the home, but just dropping off to the home. And these flexibilities should last through September the 30th. We do have a caseload now of 4,309 enrolled in the WIC program, and that is 119% of the required baseline case count. So these flexibilities have allowed additional people to enroll in the WIC program, and we have seen that increase. So we're very pleased that people are taking advantage of that. Environmental health, we are still looking for a division director. Mark Phelps retired a while back, and we have done interviews, and that position has now been reposted. We're looking for a qualified applicant for that, so we'll continue to work in that area. And I believe that's it. Marcia Hall gave the administration, division, and finance report, and also talked about staff vacancies, and we're working on filling those. And then other issues that Dr. Silvernail has been working on, he's been working really closely with the schools and their reopening. He has reviewed and discussed COVID-19 with the Pitt County Board of Education. He did a formal presentation with them. He has had multiple telephone and email consultations with various school officials. He's also preparing an infection prevention training for school staff. And on the 6th of August, he met personally with 6 local faith-based preschool programs to discuss their reopening concerns. So he's been very active with trying to get those facilities reopened in a safe manner. And that's all I have for Dr. Silvernail's report. Do you have any questions?
Very good. Well, thank you very much, Amy. Does anybody have any questions for Amy? Well, again, thank you very much for substituting for Dr. Silvernail. We appreciate you providing his report and giving us an update on how he's doing. We hope to see him back soon. Does anybody have any additional business? If not, we're going to go into closed session, and we're going to have Betsy Wallace is going to read out the motion.
Okay. Pursuant to North Carolina General Statute 14318.11, Section A, subsection 6, the board will now go into closed session to consider qualification and elect new members.
I see Dr. Hayes and Tina Dixon. So, Dr. Hayes, okay, very good. Thank you. All right. We need to do a roll call.
Yes, sir.
Okay, yeah.
Tom Colson.
Hi.
Rex Fleming.
Yeah.
Scott McIntosh. Okay. Okay, we have a thumbs up.
Thumbs up, okay.
Kelly Pack-Smith
Yes, present.
and Lowell Spate.
Okay. All right, very good. We're in closed session then, and okay, I'd like to welcome everyone back to the open session of this August meeting. Are there any other, thank everyone for their patience. Are there any other questions or comments tonight from any of the board members? If not, before I ask for a motion to adjourn, I'd just like to remind the public, as Commissioner Colson said earlier, about folks wearing their mask properly in public, practicing social distancing. If you happen to cough, cough into your sleeve, if you're in a setting without your mask, wash your hands frequently, and we certainly hope to see these numbers of COVID positive cases and hospitalizations go down soon. Is there a motion for adjournment? See Dr. Hayes and Kelly Pack-Smith, looks like.
So moved.
Any further discussion? All right, we'll let Betsy do the roll call. Yea or nay?
Okay. Tom Colson,
Yes.
Tina Dixon,
Yay.
Scott McIntosh,
Thumbs up.
okay, and Lowell Spate.
Thumbs up again.
All right.
All right, thank you very much. Meeting is adjourned.
Thank you.
Y'all have a good evening.